Vaccines used in national immunization programs are safe and effective if used correctly. However, no vaccine is risk-free, and adverse events can occur after a vaccination. This video will show you how to use the AEFI kit. What is inside this AEFI kit? Adrenaline, disposable syringe, cotton wool, adhesive tape, IV drip set, CD resin, paracetamol, normal saline, dextrose, scalp vein set, IV start kit, AEFI kit explainer, AEFI reporting form, anaphylaxis job aid. The AEFI kit needs to be checked every 4 months. While checking, make sure all items listed are available. Check all expiration dates and report them in the dedicated table. Inform EPI managers if products need replacement. For medicine dosage, check the back of the explainer. How to recognize and manage anaphylaxis. You need to be prepared to recognize and treat the patient immediately. Acute allergic reaction usually occurs 5 to 60 minutes after vaccination. Allergic reaction may include generalized skin itch and rash, sneezing or red and itchy eyes, nausea and vomiting. These mild symptoms may rapidly progress to anaphylaxis. Any one of these symptoms should alert you. Difficult noisy breathing, swelling of tongue, swelling tightness of throat, difficulty talking, hoarse voice, wheeze or persistent cough, persistent dizziness or collapse, pale or floppy in young children. To manage anaphylaxis, follow these steps. 1. Call for help. 2. Lie the person on their back and raise the legs. Monitor airways, breathing and circulation and start CPR if needed. 3. Give 1000 adrenaline by intramuscular injection. Refer to the table in the AEFI kit explainer for dosage. 4. Give oxygen by face mask if available and secure an IV line. 5A. If their condition has not improved after 5 minutes, give another dose of adrenaline. Keep giving every 5 minutes until the ambulance arrives if their condition does not improve. 5B. If possible, insert an IV line and administer normal saline 20 ml kilogram over 20 minutes. 6. Transfer the person to hospital for further observation and treatment. 7. Record the incident, including doses of adrenaline given. Most frequently, common minor AEFIs will occur. For minor allergic reactions, once you have ruled out anaphylaxis, you can administer antihistamines. For pain, headaches or fever, you can administer paracetamol. For these mild symptoms, most important is to reassure patients and ask them to come back if no improvement after days or worsening of the symptoms. Report AEFI. Using the AEFI reporting form. For serious or unusual AEFI, make an urgent phone call to DHO or PhD and send your reporting form via WhatsApp within the next 24 hours to the upper level. For other AEFI, make sure you send a reporting form via WhatsApp within 7 to 10 days.